And with that, I think we're going to go ahead and get started this morning. Good morning, everybody. Welcome to today's webinar, One for the Road, Using Data to Prevent Impaired Driving as a part of Minnesota's 2021 Towards Zero Deaths webinar series. My name is Mike Hansen, and I am one of the TZD co-chairs, and I currently have the privilege of serving as the director for the Department of Public Safety's Office of Traffic Safety. Before we start this morning, I'd like to offer a few thank yous out there to all of our supporters and everybody who makes these webinar series possible. Well, first of all, I'd like to thank my partners at the Minnesota Department of Health, the Minnesota Department of Transportation, obviously my partners at the Minnesota Department of Public Safety, and our supporters at the National Highway Traffic Safety Administration. We also have a number of corporate sponsors who graciously agreed, even in this virtual world, to continue their support for the TZD program and everything that we do and represent. So a big thank you to Bolton and Menk, to AAA Minnesota Iowa, the Auto Club Group, to HDR Engineering, to Highway Federal Credit Union, and the Minnesota Prevention Alliance. Thank you to all of our sponsors for supporting traffic safety and the Minnesota Towards Zero Deaths program. Before we start this morning, we have the opportunity to recognize one of our key contributors, and it's our pleasure to recognize the 2021 Education TZD Star Award winner, Crystal Hepner. This award is given to Crystal Hepner in recognition of her creativity and her expertise in implementing traffic safety efforts as the Douglas County and Grant County TZD Safe Roads Coalition Coordinator. Crystal has been leading efforts to reduce crashes in West Central Minnesota with TZD since 2005. As a health educator with Horizon Public Health, she uses social media messaging to educate drivers and organizers of many events at local schools, health fairs, and other public venues. One highly successful event was a Rural Safety Day at the 2019 and 2021 Grant County Fair, which addressed topics such as agricultural equipment, ATV issues, bicycle safety, distracted driving, and seatbelt safety for a wide-ranging audience. Crystal was instrumental in organizing the many presenters, and upon her recommendation, the event is now an annual event. Crystal, congratulations, and you have our great appreciation for what you do. Would you like to share a few words with us?
Yes, thank you. I am completely overwhelmed with gratitude to have been selected to receive the TZD Education Star Award, and I'm so honored to be recognized by the TZD program. This accomplishment is not something that I did alone, and there are many others who deserve to share in this award, especially the Grant County TZD Safe Roads Coalition for their award nomination and the expertise they share to educate the community with innovative traffic safety activities. I actually began my work in traffic safety on this day 16 years ago when I started as the Douglas County TZD coordinator for Horizon Public Health. And throughout these years, I've had the honor to work with great partners in both Douglas and Grant counties in traffic safety prevention strategies. I look forward to bringing about positive change in the public health education field of traffic safety and continuing to work together with local and statewide partners towards zero deaths on our roadways for many years to come. Thank you very much for this award, and have a great TZD webinar series.
Well, thank you, Crystal. And once again, we offer our heartiest congratulations to you on a very well-deserved recognition. And we look forward to many more years of working in close consultation with you in Central Minnesota. So again, congratulations. And now I'm going to turn the presentation over to today's moderator, Tara Helm. Tara, it's all yours.
Thanks, Mike. As Mike said, my name is Tara Helm, and I am the West Metro Towards Zero Death Regional Program Coordinator. I will be the moderator for today's session. For those of you who joined late, I would like to welcome you again to today's webinar, One for the Road, Using Data to Prevent Impaired Driving. We have a fantastic lineup of speakers for you today, but first, a few housekeeping notes. If you have a question for our speakers, please put it in the Q&A, the question and answer box at the bottom of your screen. You can also ask for technical assistance through the Q&A box. We'll get to your questions at the conclusion of the presentation. If there's a question that needs immediate attention, I can interject at an appropriate time. The TZD webinar series is proud to offer continuing education credits. These listed credits are available for this webinar. To find the forms, please go to the One for the Road webpage on the TZD website. And for our law enforcement viewers, post-board credits are also available for this webinar. Please read this important announcement from the post board. Whether you are watching this webinar live or recorded, please watch the webinar in its entirety and follow the instructions on the TZD website. The link to the webpage can be found in the chat box. The University of Minnesota will submit your completed affidavit of attendance report to the post board for you. Now on to our topic for today. One for the road, using data to prevent impaired driving. We have two speakers with us today. Our first speaker is Chief Shane Michelson. Chief Shane Michelson has spent the last 25 years in Minnesota law enforcement and has been the Chief of Police with the Osseo Police Department since January 2015. Chief Michelson has a Master of Public Administration from Hamline University and a Bachelor of Science in Sociology from the University of Wisconsin-River Falls. Chief Michelson has dedicated several years to expanding his knowledge in the alcohol enforcement fields. He has been a drug recognition expert, SFST and DRE instructor, and has law enforcement phlebotomist. He played an instrumental role in bringing the Place of Last Drink pooled database to Minnesota. He is on the original task force that created the pooled program that is currently in use today in Minnesota. Our second speaker is Sheila Nesbitt. Sheila Nesbitt is the Trauma Outreach and Prevention Coordinator at North Memorial Health Hospital in Robbinsdale, Minnesota. In this role, Sheila plans and conducts programs to help people in communities reduce the number and severity of traumatic injuries across the lifespan. She formerly worked at the Education Development Center, Minnesota Institute of Public Health, and the National Crime Prevention Council.
Great. Good morning, everyone. I'm Sheila Nesbitt, as Tara said, and I work at North Memorial Health Hospital in Robbinsdale. And unfortunately, I am on site at the hospital, so I am masked today. So thanks for joining us. And hopefully you can hear me through my mask with my microphone. So I'm going to be presenting with Chief Michelson today and talking about our Place of Last Drink project. So Place of Last Drink, really to kind of get us started and have you understand, where it comes from and what it is. Really, what we are looking at is trying to identify where people were drinking prior to having an involvement with law enforcement. So at TZD, obviously, we're focused a lot on DUI and impaired driving. But we also know that alcohol impacts a lot of other calls for service for law enforcement and a lot of reasons why people might be injured and need to come to North Memorial or another hospital for trauma care. So we are trying to, we have provided a database, a way for departments to be able to collect that information that kind of, at least prior to polled, was out there. People had an idea in their head, but maybe didn't have a way to really concisely pull it together in a way that it could be useful for planning, prevention, intervention. So we're going to talk about how this project came together, and then Chief Michelson is going to show you kind of a run through of it. So poll got started here at North Memorial. We had a substance abuse prevention coalition called Partnership for Change. And we were looking and concerned about alcohol use. And traditionally, a lot of people that work in substance misuse prevention around alcohol focus on underage drinkers. So we have strategies like compliance checks and a variety of other things really focused on that underage population. But we had fewer strategies to look at for concern around legal age use of alcohol. And we know around DUIs, domestic assaults, a lot of other issues, alcohol plays a role and people are not necessarily under age 21. So we started talking. We work primarily with 9 police departments in Northwest Hennepin County. We started talking with them about what could we do around this. And they really were particularly interested in addressing overservice and getting more information about it. So overservice meaning people who are served at a retail establishment. Um, and so we started conversations with them about what that would look like. And I had proposed this idea. We had heard of similar projects in a few other places around the country, and our local law enforcement was interested. We were very glad that we had 3 departments and really 3 volunteers step up. Wait a few minutes, and I'm sure Chief Michelson is going to make a joke about being voluntold that he had to join our coalition and join this task force. But I think we were really blessed with who we had who stepped up. Sergeant Patrick Toohey, who had been with the Brooklyn Center Police Department, was terrific. He had a strong background in IT, which you'll see really shaped this project. We could have gone a very different direction if we didn't have his expertise from the beginning. We had Chief Shane Michelson join us, and I'll let him talk about himself. I like to tease him a lot, but obviously he was a wonderful partner with us at the time and still is today. Pold would not be what it is without Shane. And then we also had a community relations officer, community liaison, Jim Long from the Plymouth Police Department. And they worked with us to help create this database. So it was partially started and led by a community coalition. I'm going to talk more about coalitions at the end of our session and how they might be able to help you depending on what your role is, whether you're directly law enforcement or you're a public health department or community coalition. There's a role for everyone in Pold. But I'm going to turn it over to Shane to really talk about what is happening with Pold and what that system actually looks like.
Well, currently, Place of Last Drink in the state of Minnesota is a web-based, we created a web-based tool for officers or departments to enter Place of Last Drink data. We always had kind of an idea of our liquor establishments that might be a problem. We had all this innuendo, but never any data points to go to, especially in our small towns, out of state areas, that really you're dealing with council members and political figures that may even own a liquor establishment or at least attend a certain, quite a few of the liquor establishments in town. And so it was very hard to hold them accountable. What this web-based program does for all of us in law enforcement is when you enter the data, it collects it, and then you can pull out all the data that you need when you're looking at liquor licenses. And as a chief of police, I sign all of our liquor licenses because we are a local control state. And so I am able to take all the data we enter and then look at where people are coming from after they've had contact with us. We can tell which establishments they may be coming from. So really the offense types within the system itself that we're looking at are listed here. But we've got, in our city, we do more than just DWI. There are cities that just collect DWI info. So if someone's arrested for a DWI, they're asked where they're coming from. This is not uncommon for officers to do on a traffic stop, to ask, where are you coming from? Where are you going? And we weren't putting it as part of our report because it really didn't have any evidentiary value. Well, now that it has value, at least in my department, our officers are asked to collect that data and put it into their reports. And I'll get into that here in a little bit. We do not just collect in the city of Osseo. polled data just on DWIs. Could you go back one more, please? There. We collect on all alcohol related calls. So if our officers are called to a domestic, if they're called to a medical, if they're called to an assault, a robbery, anything that an officer would go to, and alcohol may be a factor, they're asked to ask a certain group of questions. Where did they come from? Where did they have their last drink? How much have they been drinking? We really try to get a portable breath test result. Again, that's we're asking, we're not telling. And so once we get that information, it is then put into the polled system. Next. The location types. And so when we look at different places that we're going, it's very effective to know if they came from an on-sale retailer. Was it a park, a beach, a lake? Was it a private residence? Is there a location that we need to be aware of? And so collecting this location type is very effective, especially if you're a organization that may have maybe a school or like the University of Minnesota, for instance, is on our system. They may have a fraternity or sorority location that's being a problem. Even though it's not a bar, at least they can then go back and have conversations with these people. If it's a park or a beach or a lake place, that might be somewhere that we want to do some extra patrol to see what are some of the factors that are having these locations be a part of polled. Now, this heads up display, when we created this, we were going to have, our thought process was that each individual officer would have their look at the system. And so they would log in every night, they would pull up this heads up display, and they would say, all right, where are our problem areas? What types of calls are we getting where alcohol is related? Currently, this is a snapshot of what it looks like in our current system. And we have a total number of 14,858 entries. And if you look at that, DWIs are 50.71% of the entries in our system. What's interesting is that we found was that if you only were to do DWI enforcement instead of all those other types of calls, you would only get 50% of the alcohol related information that you may need to make a decision on a local establishment, a licensed place. You would not have a full picture of your community. And that's why it was so important in the city of Osseo for us to get a look at our whole community and all call types. And you can see here, when you look at location type, retailers about 33% of what's entered into our system. All those other location types, private residence, public areas, festivals, those are other areas that are their last place of drink, or that they were drinking there before they had contact with the police. So now I think we're going to be moving into the actual system itself. And this is a question I get a lot, is how hard is it to enter one of the a case into the system? It's actually very simple. It's actually very easy. What we have found over time is that the workflow within the department is very important. And so for me and my agency, we use LETG as our records management system. And so the officers are able to send me an email that's actually labeled polled. It gives me the case number and some of the information that they type in there with a that I'll need to enter into the system. That way it directs me right to the case. When I open up a case file in the RMS system, I then go to adding a case, and I add in the case number. I add in, which is super simple. Then I add in what kind of a case it is. Is it a DWI? Is it a robbery? Is it a underage consumption? What is it? So in this case, we just click to DWI. Then we go down and we add the address and location of the offense. Okay, that can even be in another city if we went and assisted somebody, or it could be within our own city. So then the city of offense, we can click that, and all you have to do is type in, and it gives you the city. So it's a drop down box. Date of offense is the location, or is the date, the time. We put that into. Then we put in primary contact. Now we could have multiple contacts in one case, and that's fine. There could be an offender, there could be a victim, and there could just be someone that was a witness there. Gender, male, female. Age, we're putting in the true age of the person. If we were able to get a breath alcohol concentration, this is where we'll put that, whether it's just a PBT or an actual DMT, we'll put in those results. And if there were anybody injured, if there was assault and someone was injured, we can put those numbers right in here. Now, as you can see so far, we have not put any data in there that's private. We have not put any data in there that we do not collect or wouldn't give out to someone else. But this is all data that we can search by. Now, if you look, it says pulled location type. So if we were at a community event, we would just type in there. The difference is all of them except on sale retailer, this is what they'll look like. You just click it and then go down and put in last drink city, and then you go ahead and write a description, put in some comments. Those comments are searchable also, but they're very helpful in the end when I go to do, and we'll go back and I'll show you the reports. It's searchable, but it's also something for us to then highlight, for me, especially when I go to council, to highlight the type of calls and then some of those call notes. But if you look and you click on sale retailer, this is something that was very important to all of us when we were talking to Sergeant Tui from Brooklyn Center about entering data and retrieving data, is that everything needs to be spelled pretty much the same. So Al's bar has to be spelled the same. It can't be AL apostrophe S, or can't be ALS bar, because then you can't search it. So what we did is we put in every location in the state. We started off with the cities. So if you go to Osseo, which you can just type in, then you go down to last drink location, which is another drop down box. That will give you all the establishments within the city of Osseo. So whichever one I click on, I can click on it and it will put it in there the same way every single time. And that way it is always searchable. I'm not going to be missing it. I don't have to put in Osseo American Legion, Osseo Legion. It's just, that is the way it is. And then we put in notes. And again, that's so important to say, what happened during this incident? Did they steal a stop sign and walk down the street drunk? Did we find them in a snowbank drunk and then almost froze to death? Those make huge impacts when we're talking about establishments, establishment licenses, and also having conversations with owners. It is so important for us to be able to retrieve that information or pull the actual case, show them the report, and be able to have those really face-to-face hard conversations with people that really don't want to listen to us. Thank you. And then if you go back, you can look at all the different data. It'll look different than this if you are in the system, but you can look at all the data that you've put in. You can also click on that case number and it'll show you those individual cases, and it'll give you all the information that you entered. Again, you can see this is a Red Wing PD, but again, you can go through each of these different cases individually. Now, in the system itself, this is a overall view of all of the cases in the system. If you were to look at your own, it would only be your own that you would be looking at. We've got that set up so that there is only very, very few people that can see the whole system, and that if you're entered into the system as an agency, you will see your own agency's entries, and then you will be able to see not full detail, but you will still see if a bar or a license location within your city is a pulled in a neighboring city or in a distant city. That's something we're finding, especially if you were to be able to pull up Minneapolis, some of those bars from downtown show up all the way up to St. Cloud. And so you can see that it does work as far as giving you an idea what is going on in your community when it comes to place of last drink. And these are all just law enforcement contacts. And so we need to keep that in mind, that this is people that have been in contact with the police for one reason or another. And alcohol played either some sort of a factor or at least was a part of the call. The one thing too to keep in mind for the law enforcement people is that we're making sure that we're not collecting any data that wouldn't be shared it wouldn't be shared anywhere else. It would be public information, so we're not taking any private information. The other thing, law enforcement folks, and for those in prevention, what a great way to gather data to put together on gender, age, BAC levels, things like that. If you could see the whole state was collecting this information, you'd be able to deep dive, especially the prevention folks, where you'd be able to deep dive this data and be able to really target audiences that are currently using the police and for anything from medicals to crimes. So in this system itself, everything you can search, and there's different case reports, and there's things you can pull out of the system just by using the system itself. So you can do an all cases detailed report, which will pull it out. Excuse me. And you'll be able to run things by all cases public, so it removes all medicals. You can run reports on cases by officers, and you can even run it by retailer, and it'll tell you and put onto paper in Excel form exactly what you're looking for. You can do jurisdictional reports, so other departments reporting your establishments where the place of last drink, you can do a report on that. You can do your officers outside your jurisdiction, so if they were to make an arrest somewhere else, and your officers in your jurisdiction. So what we have found with this system is that it really starts conversations. It starts our conversations with not only our local license holders, but it starts conversations between agencies. We all have those liquor establishments that are right on our borders, and it's really interesting to know when you start to see one that might not be in your city, but it borders your city, to then have a conversation with a next door neighbor and say, hey, we're having some issues with Impold. Can we sit down and talk about maybe some ways we can have conversations, or at least maybe it pushes that agency next to you to have that conversation with that local establishment. This is a pulled snapshot, so this is kind of the whole system at its peak right now. Total number 14,858 entries, average breath alcohol concentration of 0.12, average age in the system is 35, 30% female, 67% male. Total number of injuries is 1,428. Again, this is from January 2014 until September 30th, 2021. So the locations, this is again a snapshot of the system. On sale retailers play about 40.73% of all the entries, private residents 34.10%, and did not report. That does happen. We just have to flow with it. We're not always going to get exact locations where they're coming from, and sometimes they are going to tell us and lie to us. And so what we've found for ourselves, again, this might be a question later, but is that we go by the overall look of a liquor establishment. And so it's not just by one or two entries, we might have one establishment that has 15 entries, and then all the rest of our establishments combined have one. Then you know you have a problem. There's something there that's going on. And so it does make that conversation a lot easier with some of these establishments, especially if we can just show that there's issues going on or trying to figure out what's going on within that establishment itself. Um, in our system right now, 64.9% of the incidents had a BAC over the legal limit. As you can see there, the average between 0.10 to 0.15 is 3,000 entries. And then you keep going up, 0.15 to 2.0 is 2,500. 2.0 to 3.0 is 2,300. And then you get up even greater than 4, we've got 58 entries. So the average BAC level is 0.119. So that 0.12 is kind of that average BAC level within the system itself. And so if you could break that down quarter by quarter or even by gender, there's a lot of good information within this system, not just for law enforcement, but for all ranges of Department of Health to prevention coordinators. I mean, this information that law enforcement could gather is phenomenal. Again, last drink location by type, a dorm room, 0.1% of it did not ask. There are times that officers just forget, and we can put that in there. We're trying to get that to be as small a percentage as we can. That other two, we're trying to figure out to see what that percentage is, that 3.7%. But again, most of them, almost 50% are on sale retailers. So we're really getting a good look at what our drinking establishments are doing. And now I'm going to turn it over to Sheila Nesbitt for this last part.
Yeah, so so we were able to take a look. You know, there's a lot of data in the database that we can access within just a couple of clicks, but there are things that we can do when we have a few more resources. So we were lucky enough to have one of the most fabulous graduate students that I've ever worked with work with us on this project. And I'm not just saying that because she's moderating this session, but we were very lucky to work with Tara when she was a graduate student. Then she came and worked with me at North Memorial, and now she is a TZD coordinator at the state. So she did an analysis taking a look at you know, the data that we have in the place of last drink database, digging a few layers deeper than what the database can just spit out at us. So at the time that she did this analysis, there were 611 different on sale retailers reported as place of last drink for someone who had a DUI incident. So you'll see really our focus here is how do we use this data? How is it going to help our TZD efforts? So clearly we know that on sale retailers play a role in our TZD efforts. So seeing these around the state, Tara took a closer look at the metro area. North Memorial, with our coalition, we were focused primarily in Northwest Hennepin County, but we took a look metro-wide to identify what are these places of last drink? What are these retail establishments? And she found 6 locations in the metro area that reported being place of last drink more than 40 times. These 6 locations in a statewide database with obviously a lot more metro departments participating, but a statewide database, these 6 locations were 20% of the DUI incidents that we had at that time. So if you want to talk about how do we focus our TZD efforts, what do we need to do, talk about a great resource to be able to say, I think maybe we need to do something with a few specific retailers. So let's take a look at the next level. So then she took a look at those 6 top retailers, the ones that have been named more than 40 times. And she did an analysis of where was the where was the driver pulled over? And the vast majority of these were within 1 mile of the retail establishment. But we had some up to, 8 of them that were 10 or more miles, up to 25.8 miles away from that retailer. And to me, I took a couple of things from this. If I am a retail establishment, or if I'm a local law enforcement jurisdiction and I have one of these establishments in my jurisdiction, how likely is it that within 1 mile of being pulled over, what could have happened within that mile? How many times are there impaired drivers on the road around these establishments, putting my citizens and people in my city at risk? But also the chance that they could be driving pretty far and putting a lot of other people at risk as well. So let's take a look at the next slide. So what do we do with this information? How do you use the poll database? And we're going to give you a case example that comes from Plymouth. And this is really one of our first examples of really looking at what to do around a problematic retailer. So if you remember, Jim Long from Plymouth Police Department was one of our original 3 task force members. So he was one of the first that started collecting poll data in 2014. He wanted to collect some data and establish a baseline of what he was looking at before he notified retailers. He then sent a letter to all on sale alcohol retailers in the city, notifying them about place of last drink. And it's kind of a funny story because we all thought, and Jim included, thought they might freak out a little bit about us collecting this information and doing something about it. But he actually got no contact back. No one called him, no one emailed, no one came with burning torches to his office. So we notified them that we were going to be collecting this data. He collected it over a number of months. In October, he had identified that there were 552 total alcohol-related cases or polled cases in the database. 103 of those calls for service or responses were listed Cowboy Jack's. It's a retailer in Plymouth. So 103 people had listed Cowboy Jack's as their place of last drink. So that was 26.5% of Plymouth's polled entries, and really pointed to the fact that Plymouth wanted to do something and needed to do something about Cowboy Jack's. So I won't belabor and tell the wonderful, interesting, mildly funny story of following up with Cowboy Jack's and them, frankly, not really caring at first about this, poo-pooing it. We don't believe you. We don't think this is good data. Now realizing Cowboy Jack's is not representative of most on-sale retailers. Most on-sale retailers were never listed in the poll database. If they were listed 1 or 2 times. Clearly, Cowboy Jack's had a significant problem, and it showed up in their attitude about the information that we were giving them. So eventually, Jim met with the retailers, the police chief, Chief Goldstein at the time, met with Cowboy Jack's, and they were eventually pulled in front of the city council. And the city council, at the time of their license renewal, said they would not renew the license. They would only give a conditional renewal, and that they would need to look at it again in a quarter. Finally, at that point, when their license was on the line, Cowboy Jack's took it seriously, and the city required a remediation plan. Cowboy Jack's, if I remember correctly, they did a number of things, like they kept their kitchen open an hour longer. They did some additional server training, and they were able to reduce the number of polled incidents that were reported from Cowboy Jack's. So you can see they had a significant reduction. It was right at the beginning of 2015 when they were given that provisional license. and their numbers have remained fairly low since then, certainly not what we had looked at in 2014. We can also use Excelsior as a great case example. In South Lake Minnetonka Police Department, they also joined the place of last drink process early. And I think I'll turn it back to Shane because I think I was supposed to do that already and I'm just chatting away. Shane, do you want to talk about Excelsior?
Sure. So the South Lake Minnetonka Police Department covers the city of Excelsior. They started collecting polled in April of 2014. In September 2018, they had 833 total cases entered into the system. 53% of the cases are DUI. They were really struggling with some of their liquor establishments. Now, if you don't know where Excelsior is, it is right down by Lake Minnetonka. They had several different bars on the lake and they were just struggling with a lot of pulled data being put in there, being a small city. So what happened in January of 2016, the city council passed an alcohol policy. The establishments required to come before the council and explain mitigation plans if there was a pulled entry at or above a 0.20 breath alcohol concentration. They created a sliding scale for how many pulls you could have per quarter based on seating capacity. And they provide amnesty. So if you self-disclose an incident, they weren't trying to penalize you for calling on your own. They do want that so that there is safety in the bars themselves, but they really struggled with trying to curb this. And so one of their best ways to curb the issues with the place of last drink data was to create this alcohol policy. And it really became part of how they look at liquor licenses from year to year. And they really use pulled heavily when they do that. And you can see the reduction in DWIs from 96. Now they're down in 2018 to 56. 2016 was their highest year. And that's when they created the policy and things started to go down from there. So there was an effect on the city of Excelsior and the types of drinking and issues that they were having. Now in Mankato, Mankato is kind of that college town, and they started collecting in July of 2014, again, very early on in the process. And as of September 2018, they had 1,327 total cases, 31% involved under 21-year-olds. So what they did is they took this information and they used it for education enforcement techniques with on-sale establishments. Again, that big key that we found for any police department or any city with their liquor establishment is that education part. And we'll get into that a little bit later for what the state is offering for all of us in law enforcement and what we can do with that education part. But they identified a gap within the system for education enforcement with off-sale establishments also. So not selling a liquor store, not selling to someone who's intoxicated and making them come to maybe a server training, not only just servers, but people in the liquor stores also. They created some internal city policies and sliding scale to determine actions against the liquor license. Their chief of police, I know, put that as part of the liquor license process. It was something that each liquor establishment signs on for when they get their liquor license, is for this sliding scale. So this is just a little plot map. And, you know, we're talking not just metro departments that are a part of this polled system. And we're talking, you know, outstate also, and there are counties that are alone that are on the system too. Really, it's built to take on whoever would like to be a part of it. One of the biggest things I want people to know is this system is free. We just need you to sign up and then we can get you started. But there's Crow Wing County is part of polled. You got Pequot Lakes, Nisswa, Baxter, and Brainerd. They came together as a group and wanted to work on POLD and their bars because it affects them all, especially during that summertime event time. Here you can see from January to May, all the different areas that people were stopped or had alcohol related type calls. And that's just in the Brainerd Baxter area. Okay, I'd like to invite Sheila back so that we can both kind of go over these facts here, but it says, what if people lie about their POLD? What do you think, Sheila?
Well, I think it's not just about one statement from one person on one evening to help us identify what the problem is. But I think people want to hear from law enforcement. Do you ever deal with anybody who wants to lie to you, Shane?
Every single day. But for us, again, like Sheila stated, and I said earlier, is that we're looking at the overall incidents, not just one incident in itself, because that's going to be a defense for some of your local establishments if they're getting talked to or having some education brought to them. Is like, well, that person lied, then they must have been next door, they could have been down the street. And that's why this is so important, to make sure we're looking at, several calls, not just one individual call in itself. And then how do you get officers to enter data? Well, as Sheila knows, we tried everything, didn't we, Sheila?
We did trying to make sure that we kept it at the forefront of everyone's minds. It's a great role for coalitions. We're going to talk about that. How do you involve your community partners so it's not just this is not just a law enforcement project. And I really want to stress that message to those of you who aren't in law enforcement. It does not work very well if you just bring the slide deck and drop it on your chief's desk and say, here's a great project for you, to realize that there are opportunities to partner. And so we as a local coalition did a lot to try to help launch it. When we were new in a department, to recognize officers for what they were doing, making sure that the chiefs and those in the administration knew who was really paying attention and remembering POLD, and helping them use this data because it's right there in the database. But, we all know how hard it is sometimes to go and do those extra clicks to go find something and monitor what's happening. So public health departments, local coalitions can really be involved. But Shane, you have dealt with this at the, within your own department.
Yep. And really, how do you get officers to enter the data? What I've come up with and my conclusion is that we don't. The officers individually in my department do not enter the data. They just let me know where there was a POLD type call. So what we found is single point entry works best. And that is finding someone who could be a supervisor. It could be somebody in administration. It could be a crime prevention person. It could be anybody within the department. And all they need to do is figure out their workflow. How do we get the report from the officer to the person who's entering the data? And really trying to leave it up to officers, it just doesn't work. And what you do with the data is really up to each individual department and who's using POLD. We like to use it. I like to use it to have conversations with our local license establishments. I've done that on several occasions. And, as we found, most owners and license holders do want to be a part of the community. They really do want to have these conversations. They are difficult at times, but how you deal with them, and if we can use it as an educational point instead of an enforcement point, really in the end, I think works out better for everyone. They do want to be a part of the community. They don't want to see people getting hurt. They don't want to hear about some horrible thing that happened after they left their establishment. But as we know, owners aren't there 24 hours a day. So it is a great resource for us to come back to them and say, hey, listen, we've had an issue last night or last week, and we really want to talk about it and see what we can do for you. And I think that's what's worked out best for us.
Yeah, and now we'll talk about another opportunity of a way you can use this data. The Department of Public Safety has recently relaunched some of their work around responsible beverage server training, which is a great complementary strategy along with POLD. I know that the curriculum that they use includes some pieces on over service, whether you're using theirs or a different curriculum or if private trainers are coming in to offer in your community, really encourage you to make sure that over service is part of that conversation and part of that training, and that that you are telling your retailers to make sure that they have a plan. When we talk with retailers, they really somewhat don't think over services happening at their establishment, or they don't think that there's anything they can do about it. So really building that into your responsible beverage server training is important. But like Shane says, not everybody is really open to this conversation right from the beginning. So another strategy to consider is retail alcohol vendor enforcement and education, or called RAVE. And this is a program that we adopted from the Alcohol Gambling Enforcement Division at Department of Public Safety. And it is the idea of allowing, going into establishments to observe firsthand what is happening, to be able to monitor and observe those selling practices, because the poll data helps us identify where there might be problems. Especially as Shane is talking about, if you get those case notes, you have the date, you have the age, you know what happened. This person fell off a bar stool on Saturday night. Their BAC was this amount. That's a great conversation, but there are still some of those outlier retailers that still will not think that there's an issue or anything that they can do about it. So RAVE allows us to go in and observe what's happening. You can take a look at the next one. There's a brief observation form that you can fill out to document what you saw at that location. You can go to the next one. You can either provide feedback during that raise shift, speaking to the manager, talking about what's happening. You could even, it might be an opportunity, or there might be a need for enforcement action against someone who's egregiously over-serving alcohol. Recognizing that if you do it in the midst of a rave shift, it might activate that phone tree. So we try when possible to not have to take action during the rave shift, but we can do it at the close of a shift or afterward by a letter from the department, or a great opportunity again for that stop and chat. Hey, we have some poll data that shows us patterns over the last few months or the last few years. And here's what we've seen at your establishment. Our officers and community volunteer came in undercover and observed practices on Saturday night, and here's what we saw. So it provides, again, more data for that conversation. Remembering that, some of these, those 6 retailers that we focused on in the metro area are not representative of all retailers. So we do encourage you to recognize those who are not listed. Make sure that the retailers who are doing a good job are recognized for that. For those who are seldom listed, recognizing everybody makes mistakes, but maybe that manager still wants that information, and so that they can follow up, that idea of a teachable moment. And you can recommend responsible beverage server training, and maybe even ask them, hey, beef up that section on over service. Make sure that your employees know that you as a manager will back them up if they have to cut off service, or talk through what language do we use and how do we do that gently. Okay. For those that are frequently listed as a place of last drink, there really are a whole host of opportunities. And like Plymouth, you may want to kind of stage that out, starting with a meeting with your crime prevention officer or community liaison, providing them information, letting them know we will notify you when when a new case comes in. But considering up until doing a license revocation or a suspension or some type of license penalties. Okay. talked a little bit about the role of coalitions. I just strongly advise you to have to use your local coalitions, your local public health department, or other partners if possible. This does not have to all be on law enforcement. And with that, I think we'll open it up to the Q&A.
Thanks, Chief Michelson and Sheila. We have a few questions that have come in. So one person in the chat said, I love the system. Is there a website available to view in Minnesota?
Do you want me to take that, Shane?
Yep,
There
go ahead.
is a website, and that's how you access it. The data is not publicly available, which actually is, I think, reassuring to some law enforcement departments. It's not that you're putting your pool data in there and you have no control over where it goes. If people are interested in place of last drink data, they have to follow the normal data practices guidance and contact your police department and ask for that information. So you still have control over it. For law enforcement departments that want to participate in the place of last drink project, they can contact us and get signed up in that database. Do you want to talk more about it, Shane?
Yes, with the data practices, again, we're not collecting any information we wouldn't give out, but someone to get this information needs to go to the individual agencies themselves. Otherwise, we can set you up in Pulled if you have a reason to be in there, like a law enforcement department. And if it's not, then we do use it for some educational opportunities. The University of Minnesota, I know, is currently doing a study, and there's some other things that the Minnesota Department of Health has some access to it as well for educational purposes only. And so that's really who has access to the system.
Okay, thanks. We'll move on to the next question. So does any police or data collection agency track impairments, sedation by sedatives other than alcohol or ethanol?
We do not currently, but I've always said, I think if it were to become part of, if we were to become part of the say marijuana legalization, I think Pulled could be used for that very easily. We would just have to call it like Pulled plus D, drinking and drugs, and then we could absolutely track that. I felt that this is an easy transition for us to move right into using it for drugs also.
Okay, thanks. And is it possible for Pulled to make reports for single cities and a group of cities for a single agency, asking for agencies that have several contract cities?
Yeah, that's exactly what we do for South Lake Minnetonka. So it's one law enforcement agency, but they have multiple cities that are part of their system.
Okay, thanks. Somebody wrote in a comment, there appears to be a marked discrepancy combating DUIs and incidents of in-vehicle. Any comments on that?
I'm not sure I understand what they're getting at, other than potentially we did, I think through law enforcement feedback, that category of, type of offense simply was DUI when I was making categories and figuring this out, I mean, with some input, but then they pointed out, well, what about CVO? What about CVH? So we've put that together in kind of a broader traffic related category. I don't know if that gets at what the person was asking.
Okay, thanks. And then is it possible that the locations that have the majority of the Pulled locations is skewed by the level and intensity of enforcement near them?
It could be, but typically, especially now, things could be skewed with COVID too for a while, with total numbers. And those are some of the factors that research people do, not police departments typically. We're not very good at that information unless we have somebody on our staff that does that. but of course they could be skewed with, more enforcement in a certain area. And that would have to be something taken into consideration when you're looking at your overall numbers.
And I think it's going to be skewed largely by your department. If you're addressing the retailers in your city, then all retailers had a chance to be place of last drink for that DUI you pulled over. You really don't know when you respond to that domestic assault where those people have been drinking, but you're responding to domestic assault the same as you would respond to others in the city. So it's not one single incident on its own. It is that pattern. But if that pattern is skewed for one retailer, it has the potential to be skewed for other retailers as well. Um, and so to be aware of that is important. But again, as part of that conversation with the retailer, if you're 40% of our incidents in the database, why is that? What is happening? One thing with the database, you can also take a look at days of the week, time of day. So if there's a specific problem on Wednesday night, having conversation, who is your staff on Wednesday night? What are your drink specials? What's happening that makes that night higher than others?
Okay. And then the last question right now that's come in terms of DUIs, are there opportunities to promote rideshare services or to provide discounts, et cetera, within establishments using some of this data? What are the challenges and opportunities there?
In my personal view, as a chief of police, I think ride shares are great. It's just hard to get people on board sometimes, and having that champion to come to town and put it all together. I think that's what's very difficult at times. And we found that I've been approached a couple, two, three different times with different ideas on ride shares or getting them into our local establishments. And I'll tell you, it would be it's very helpful to have relationships with your establishments, which Polled can create for you to get those ride shares or those opportunities in front of some of these owners to see what kind of buy-in you can get.
And I think it's also helpful to remind people because retailers will often focus solely on DUI as the problem for overservice. It's 50% on average, 50% of the incidents that we see in there. So a ride share is not necessarily going to stop the domestic assault that happens when those people get home. We have quite a number of cases of people that didn't drive home from the bar, but were walking home in sub-zero temperatures, fell asleep in a snowbank. So there are a lot of other situations that can happen. So I know TZD is focused on impaired driving, rightfully so. That is a concern. But when talking with those retailers, a ride share is not going to solve their problem if they are overserving. It's not going to reduce the harm that may come from people over consuming at their establishment.
Okay, great. And then I'll just switch over to the evaluation slide. So thanks again to our speakers and to today's viewers. We hope you learned something new and will share your knowledge with your colleagues. A link to the evaluation can be found in the chat box and will also be emailed to you. Please take a couple minutes to fill out the survey. The TZD leadership team does read the results from these surveys and uses this information for future events. I don't see any other questions at this point that have come in. Did you, Sheila or Chief Michelson, have any other closing comments that you wanted to go over today before we wrap up?
Sorry for my screen color, but just one thing that I would like to put out there that our agency uses, which has been very, very effective. Not only do we use Polled, place of last drink, but we also use RAVE, where we send undercover officers in to observe our local establishments. We actually do timeshares with other agencies to do that because we're just too well known and too small of a community to send in our own. But we also do the responsible beverage server training ourselves, where we have our own officers teaching the training and having connections with our local servers, which has really turned our our connection with each other around to where it was adversarial before, to where now we work hand in hand with each other, and there's an expectation there. But then we also do our underage consumption checks a minimum of 2 up to 4 times a year. And we do half of the city on one and half on another, and we try to do it quarterly, so that we do it 4 times a year. So our hope is that we do have a pretty good pulse of what's going on within our community when it comes to alcohol. We're like any other community. We're a small community, but we have a high density of liquor establishments, one of the highest in the state as far as liquor licenses versus population, because we're so small, and we're a metro department. So that makes a huge difference. But I think when we use all of these different ways of keeping an eye on our liquor and our drinking within our communities, we can really make a difference.
Thanks, Chief. And a couple more questions have come in. So another one is, what methods can be used to reduce incidents where polled is listed as a private residence?
Well, what's interesting is we'd love to do that. The problem is some people, especially during COVID, they drank at home and then got behind the wheel and drove somewhere else. Or they're coming from a birthday party, or they're coming from a graduation party. And so trying to cut that down is very difficult, because a lot of people do either drink at home and then they need to go buy a pack of cigarettes, or they go out to dinner, or we're dealing with them domesticating in their own residence while they've been drinking at home and they haven't left. And so we do see that quite a bit within a private residence. I have no idea how we curb that, or how we can cut that down when people are drinking at home.
Yeah. I think we saw some of that. That was a bit more of the situation in Mankato, and a lot of the private residents were, house parties, rental properties off campus. So potentially, especially in a campus community, there may be a lot of work that you're doing with landlords around who are they renting to, what are the requirements for student renters or for any renters around having loud parties. You could look at some of the loud party noise ordinances, large gathering type of things for those residences. Um, and depending on the resources available in your community, if a particular private residence is coming up often, there may be some additional non-law enforcement resources that they need around substance abuse intervention and resources. So remembering that oftentimes if people have a substance use disorder, an interaction with law enforcement might be a teachable moment for them, an opportunity to intervene, for them to rethink some of their behaviors, and maybe be ready to be open for some resources and assistance.
Also, if we're dealing with underage consumption at residences, we can also institute our social host ordinance, which our city does have. So that is another strategy to use for some of those private residence issues.
Okay, and then the last question that's in right now is, although I know the primary focus is for on-sale retailers, has there been conversations regarding tracking alcohol compliance checks for off-sale? It would be great to capture all alcohol-related data in one place.
We currently track all of that within our records management system because a case file is taken. So for any type of consumption checks or anything like that, we do that through our records management system, not using polled, since that's more of an active call for police is polled, more than actually going out and creating a call and saying, okay, we're going to go check our licensed establishments. That's how we track it in Osseo, and I think most agencies do.
Yeah. And I happened to one of our having a conversation with an off sale with a liquor store in one of our communities when we were really beefing this up, and that manager came to a responsible beverage server training. He really didn't know that the over service statute applied to an off sale retailer, and he talked about people coming in intoxicated and purchasing alcohol, and was going to go back and make sure that his employees really understood that they had a responsibility to decline that sale, and they were going to talk about how they would do it. So there is still a role for an off sale retailer, but they just may not be actually observing the consumption that led to the interaction with law enforcement. Because usually they won't be listed as a place of last drink, except like a wine tasting or something where they were there. And usually at a wine tasting, people would not drink to a level of impairment, but it may be that somebody comes in intoxicated.
Okay, great. And then one of the questions that was just asked in the chat was, does OSSEO require responsible beverage server training, or is it just encouraged? And Chief Michelson responded that it's required yearly for all servers via the ordinance. Do you want to just touch on that about what other cities do?
Each city is a little bit different. Some require the yearly responsible beverage server training, but the bars or the liquor establishments do that on their own. And then they just have to be able to prove that they did some sort of liquor or server training. In the city of Osseo, we have an ordinance that we have to, each server, number one, once they're hired, they have 6 months to get a server training done. And then it's yearly after that that they have to go to a server training. We are required, the police department, to put that on twice a year. So every 6 months, we offer it to our liquor establishments. If they are to get their own and pay for it on their own, because it's free through us, they have to get it through me and show me their certificates and also what training that they're going to. So I'm able to make sure that it's covering all points.
Great, thanks. Okay, well, I think that about concludes today's webinar. We do not have any other questions at the time, so just a reminder to all who joined us to please again complete the evaluation survey. There was a link in the chat, or you can use the QR code on the screen right now. And thanks again to our wonderful speakers, Chief Shane Michelson from Osseo Police Department and Sheila Nesbitt from North Memorial Health Hospital.
Okay. On the bed. I'm gonna call my boss. Okay. I thought they were. Hi, good morning. Hey, can you stop the webinar? Go ahead and just hop in. My screen locked up and it's still running. Yeah, that's okay. When Tara shared her screen, I couldn't get anything. I couldn't get any new chats, any Q&A. So I've been texting with Susan. Let's see if that works. And oddly enough, Susan isn't unable